Hello everybody, welcome to my channel. This is a pathology video on respiratory pathology. This is the fourth in the series of videos on bronchiectasis. The topic covered is morphology and complications of bronchiectasis. This is by Dr. CSBR Prasad, Professor of Pathology, Sri Devarajaras Medical College.
So bronchiectasis usually affects the lower lobes. In many of the cases, they are bilateral, and tumor and foreign body aspirations may be associated with a localized single segment involvement in the bronchiectatic process. And these airways are 4 times dilated than the normal bronchial passages. These morphological appearances, depending upon their shape, they are described as cylindrical, fusiform, saccular, varicose, but usually these features are radiological. And cut section of the lung shows dilated cystic spaces, giving rise to the appearance of honeycomb, so it is known as honeycomb appearance of the lung. So this X-ray shows the dilated bronchial tree cystically. You can see that cyst formation and dilatation and cystic variety of bronchiectasis. Here there is uniform cylindrical dilatation, so it is cylindrical variety of bronchiectasis. Here again you will see the cystic dilatations of the bronchial tree. And cut surface of the lung involved in bronchiectasis, you may see the lower portions of the lung most commonly involved, and they are showing dilated cystic spaces. They are nothing but the bronchi and bronchioles. So these dilated cystic spaces reaches even the surface of the lung, so they are very close to the pleura, which is abnormal. So if you try to trace air passages from the mainstem bronchus towards the periphery, you cannot go to the pleural surface, and you will be stopping short of 2 centimeters from the pleural surface. This is a normal thing. But if you can trace the bronchial tree to the surface of the pleura or beyond this 2 centimeter level, then the patient must be suffering from bronchiectasis. So again, the dilated bronchus almost reaching the periphery of the lung. Here the cut surface of the lung showing multiple cystic spaces involving entire lung, and this is a bronchiectasis which is very commonly seen in any patient suffering from cystic fibrosis. So cystic fibrosis is a genetic mutation which affects entire lung, so the bronchiectasis cannot be confined to one portion of the lung, so which is normally seen in any acquired variety of bronchiectasis. So if you see entire lung involvement in bronchiectatic process, probably you are dealing with a case of cystic fibrosis. So recurrent attacks of infection causes fibrosis, and here you may see the flimsy fibrosis of joining or in between the lung lobes. This is the microscopic appearance of lung in bronchiectasis. There are 2 bronchi which are dilated, filled with inflammatory exudate, and there is ulceration or discontinuity of the epithelium, that is ulceration. And in addition to that, peribronchial and also in the nearby air spaces or alveoli, there is inflammatory exudation. And again, closer view showing inflammatory exudate composed of neutrophils mainly present in the bronchial lumen, and also ulceration of the epithelium can be appreciated in this image. So clinical course, usually it is a long duration, and for many years they suffer, and there is progressive loss of the lung parenchyma, which ultimately results in dyspnea, orthopnea, and cyanosis, which is considered as severe. And in addition to that, in the initial stages, patient may have, as I was telling, persistent cough, which is productive, and the patient will be bringing about foul smelling, large quantities of sputum, which may amount to half a liter per day. So the complications of bronchiectasis. Bronchiectasis is a constant focus of infection, and because of this focus, the organisms may spread from that focus to the varieties of areas in the body, producing abscesses in different sites. So you will call this as metastatic abscesses. In bronchiectasis patients, usually brain is affected by this metastatic abscesses. In addition to that, the patient may suffer from recurrent pulmonary infections, right-sided heart failure. So this is due to the recurrent infections cause fibrosis, and this results in pulmonary hypertension, and this is reflected on the right side of the heart. Ultimately, right side heart fails due to pulmonary hypertension, and this type of heart failure secondary to the lung pathology is called as cor pulmonale, and some of these patients may land in massive hemoptysis. Some of these patients may land in massive hemoptysis. To leave you, there is a question: what is the dreaded complication of any chronic inflammation? So leave your answers in the comment column. We will get back to you with a correct answer in the course of time. Thank you.
Thanks for watching. Please subscribe by clicking the button subscribe.